Hematology, oncology, pharmacology, anti-cancer, monoclonal antibodies. All right, so for these, we're not going to be targeting specifically the cell cycle or DNA synthesis. We're going to have direct antibodies that should help us block the cancer cells. Now, this is kind of a new type of pharmacology that's been used in recent years for oncology and chemotherapy. And it's a lot more sought after now. Okay, so it's not something that you're going to be tested on, but just kind of an interesting fact. We've kind of been moving away from the drugs because of its toxicities and hopefully been kind of finding new ways to attack cancer. Okay, so I'm only going to be covering a very small amount here, but once again, cover it in sketchy for the in-depth details, but these are the highest yield things that you must know for step one. Okay, first thing that you have to know is for our rituximab, okay, rituximab is our anti-cancer monoclonal antibody. Its target is CD20, and CD20 obviously is on B cells, okay? Now, the adverse effect here is that we have an infusion reaction due to the fact that once we infuse a patient with rituximab, we can get a cytokine release because we have rituximab interacting with its target, CD20, on B cells. This leads to that cytokine release causing an infusion reaction in patients, okay? Number two is trastuzumab. Trastuzumab targets HER2 receptor, and this is obviously going to be used for breast cancer, which we'll talk about the HER2 receptor in repro, but HER2 targeted by trastuzumab can be used to treat breast cancer. Now, one adverse effect is dilated cardiomyopathy, which is often reversible. So remember, the two things that can cause dilated cardiomyopathy is trastuzumab, as well as the most important one, doxorubicin, okay? Moving on to anti-cancer small molecular inhibitors. The one and only one that I care about is going to be imatinib, okay? Imatinib, its target is the BCR-ABL, okay? Also other tyrosine kinases. But BCR-ABL, right, is that Philadelphia chromosome. So we're going to provide it for anyone that has that Philadelphia chromosome, give them imatinib to target that BCR-ABL. So mainly going to be helpful in usage against CML because that's where we're going to mainly see our Philadelphia chromosome. Essentially for everything else, what we need to know is leucovorin. Once again, I talked about leucovorin just a little bit ahead and how it can be used to reverse the effects of methotrexate and that it can be used to help enhance the effects of 5-FU. So what does that mean for us? What does leucovorin mean? It's just a folic acid supplement, okay? So it's a tetrahydrofolate precursor, and so it's going to help us produce more folic acid. And at first, that might seem, okay, that's kind of hard to understand, but if we look back, methotrexate is a folic acid analog, so it blocks that folic acid production. So if we provide leucovorin, which is a tetrahydrofolate or folic acid precursor, then that helps us understand why leucovorin can be used to change or mitigate the adverse effects of methotrexate because we're essentially just replenishing our folic acid there.